Welcome to Your Source TV, where we explore new approaches to wellness. Our guest today is Jonathan Gilbert. He's the president and founder of the Gilbert Clinic in Bethesda, Maryland. You established a clinic that integrates Eastern and Western medicine. Why did you take this approach?
The Gilbert Clinic was the creation of myself and Dr. Janine Blackman some 3.5 years ago. And it was designed to show an integrative medical model that could truly be effective. What we meant by that was combining the best parts of Western medicine with the best parts of alternative medicine to create an integrative medical model that could actually treat people effectively over the long term.
Mm-hmm. And what has been the result of this approach?
We've met with great success. Initially, we both worked at the University of Maryland at the Integrative Medical Center there. Dr. Blackman was the medical director, and I was a senior consultant for traditional Chinese medicine. I'm actually the quack of the outfit, where she's the real doctor. And we decided that we wanted to create a clinic, as I said before, where we could show this integrative model in action. And it came from our work that we'd already done at the University of Maryland. And so the results really speak for themselves. There were patients making, and continue to make, great improvement under our care. And that's been really a continuation of that process we started at the University of Maryland.
How could the people in America benefit from Chinese medicine?
I think this goes back to the model we created at the Gilbert Clinic. Chinese medicine takes a different view of medicine than allopathic or conventional or the medicine we're used to in America today. When you go and see a doctor, you're going to get really allopathic care. That's conventional medical care. It's the name we give to it. Chinese medicine comes at medicine from a different angle. And really the strengths of Chinese medicine lie not so much in its immediate care in terms of acute medicine or in terms of working with people in acute situations where maybe an arm's broken or there's a high infection or a high fever. It deals more with conditions of people's lives and the results of those lives. So we deal with really the chronic disease paradigm. People who've been ill or people who have illnesses that really have taken time to develop and can be a result of the lives that the person or the patient has lived. And by addressing the patient in terms of Chinese medicine and with the framework of Chinese medical thought, what we're able to do is to create effective treatment strategies. When we do that, it's incredible what we can achieve. It's worth pointing out with that we don't discredit or get rid of Western medicine or allopathic medicine. It's a process of integration. It's a process of bringing them together. And it's really still in its infancy within the United States today. And it's something we feel there's a great scope of development, not just in the practices, which people may have seen acupuncture being done or even Chinese herbal therapies, but it's more in the method, the way in which we approach the patient. I think there's a real vacuum in America today for that sort of care and that sort of approach towards people's care.
How can people find out about Eastern medicine? How can they find out how it can help them?
The best idea, I would say, is to actually go and chat to somebody who practices it. There's certification exams that are national. It's called the NCCAOM, the National Certification Commission for Acupuncture and Oriental Medicine. And if someone has NCCAOM licensure, sorry, I always have trouble with that word, then they've passed a national board or a national certification process. And that's accepted in most states within the US as a benchmark of being competent. So it can start there, and if you see somebody who's nationally certified, then go and have a chat with them, talking to that practitioner about what they do and the approaches they take. And that will actually build a sense of knowledge, a sense of education, and a sense of trust in the process.
What is the traditional Western medical treatment and result of these conditions that you treat? You know, fibromyalgia, chronic fatigue syndrome.
The Western approaches, unfortunately, up until the present time, and including the present time, have been nothing more than management. One of the problems we have with chronic illness in America is that our present medical system isn't set up to actually treat it. We tend to fall into a paradigm of management. It's really the fault of history, if nothing more. What I mean by that is that Western medicine was designed to treat the conditions that were most prevalent in the societies in which it was developed. Okay, sounds a bit wordy. So what we mean by that is this. In the 20th century, there were two things that really caused more suffering and harm to us as Americans, as Europeans, than anything else. Those were infectious disease and war. And so our medical system responded to those needs. They were the biggest needs, and so they were responded to. And so a lot of the breakthroughs that happened in medicine in the 20th century revolved around those two situations, infectious disease and war. The great advances in medicine, public health, clean water, clean sanitation, led to a great diminishment, a reduction in the amount of people who were suffering from infectious disease. The breakthroughs in surgery and anesthesia have led to breakthroughs in repairing people from traumatic injury, the development of psychiatry to help people who get sick from the results of catastrophic events like war and what have you.
You say you help the patient take control of their symptoms, get to the point where they no longer need treatment and can live freely without pain. How does that differ from Western medical treatment alone?
Just before the break, we were talking about how Western medicine was designed really for the immediate needs of the society it was in. We were dealing with wars, we were dealing with infectious disease, we were dealing with public health issues. And that's really where Western medicine has focused its efforts. When we look at modern society, we're really looking at conditions that don't fall into those two categories. We're looking at conditions of chronic disease, of chronic ill health. And so we apply the best tools we have. We apply medications, public health measures to those conditions, but they really only provide support. They provide management of a symptom. When we deal with complex chronic conditions, excuse me, like fibromyalgia or chronic fatigue syndrome, type 2 diabetes, or even more of the chronic neurological conditions, I think what becomes effective is the need to look at those conditions not with regards to just the immediate signs and symptoms the patient's having, but also with the perspective of their lives.